Hello, good afternoon. I'm Dr. Emmanuel and I'm a family physician. I have a diploma in clinical dermatology. I want to just go through a few slides on ochronosis. So, the first thing is let's define ochronosis. So, ochronosis, as you can see in this picture, is a bluish black pigmentation of connective tissues, usually due to the deposition of homogentic acid or pigments that resemble homogentic acid. As you can see in this picture, you can see this person's eye, you can see the blackish, blue, blackish deposition on their sclera, as well as their skin. So this is actually endogenous ochronosis. This person has alkpatonuria. Now there are two types of ochronosis. We have the endogenous ochronosis and we've got the exogenous. So endogenous means the problem is coming from within the body. Exogenous means the problem is coming from something that has been used, something outside, external. Now, endogenous ochronosis happens in people that have alkaptonuria, which is a metabolic and inborn error of metabolism due to an enzyme deficiency, as we'll get to find out very soon. Whereas exogenous ochronosis is due to prolonged or let's say chronic use of certain topical agents like hydroquinone cream. Endogenous ochronosis seen in alkaptonuria, and that's an autosomal recessive deficiency of homogentisate 1,2 dioxygenase, which is an enzyme that is important for the breakdown of homogentic acid enzymatically. So when it's deficient, then there's a buildup, there's an accumulation of homogentic acid, which is what causes the endogenous ochronosis. People that have alkaptonuria will typically present with darkening of their urine when you allow the urine to stand. Keep the urine to stand, especially when it's exposed to sunlight or just light. Generally, it polymerizes, it darkens. There will usually be bluish black pigmentation, so the cartilage, the sclera, around the face, different parts of the skin, the nasal bridge. This homogentic acid deposits in bones and cartilages and can lead to degeneration or wear and tear of certain joints, leading to arthritis, arthritic damage to the joints. This image illustrates, the enzymatic pathway or cascade of breakdown of phenylalanine to tyrosine, and then you can see homogentic acid being a substrate, and once that homogentisate 1,2 dioxygenase enzyme is deficient, then there cannot be further breakdown of homogentic acid, then accumulates, leading to alkaptonuria or endogenous ochronosis. This is a picture of a person with alkaptonuria. You can see the extensive blackish, blue blackish deposition on their face there. You can see the tympanic membrane of another patient having this bluish blackish deposition. You see the pinna or the external ear having that as well. This is alkaptonuria. And one thing, because alkaptonuria causes endogenous ochronosis, you can see there's widespread abnormal pigmentation. It's widespread because it's endogenous and enzymatic deficiency, and it can happen in so many parts of the body, can affect so many parts of the body. Whereas exogenous ochronosis happens with topical application of phenolic compounds, phenol derivatives, creams that contain phenol, hydroquinone, which is a phenol derivative, resorcinol, another phenol derivative, and antimalarials that have a phenolic structure, like chloroquine, can cause exogenous deposition of ochronotic pigments. And what happens typically is that there is polymerization of these phenolic compounds and then leads to the deposition of these ochronotic pigments at the dermal layer of the skin. And these ochronotic pigments are similar in structure to homogentic acid. They have that phenolic structure when you look at their biochemical structure. This is a picture that shows exogenous ochronosis. This gentleman used hydroquinone for a prolonged period of time, and he has this slate gray to blackish deposition on his nose and his cheeks, as you can see from the picture. This is exogenous ochronosis. A lot of the time, people use these hydroquinone creams to treat things like post-inflammatory hyperpigmentation, melasma and other forms of actinic lentigens. They use those, or lentigos, they use these creams to try to treat that, and because they use it for many months to sometimes even years, they then develop this ochronosis. This is a demoscopic picture showing what ochronosis typically appears or looks like under a demoscope, under magnification. The blue gray amorphous area, curvilinear or banana shaped dark structures, background reticulate pigmentation. Now, if you look at this picture, I'm not sure why my mouse isn't showing, but if you look at this picture, you could see the streaks. Yeah, the bluish gray blackish pigmented streaks, and there are some blood vessels as well with a little vaporization. um, Now, because a lot of these people use it for different forms, use these creams for different forms of pigmentation, like for instance melasma, it's quite common to see melasmic features mixed with ochronotic features on dermoscopy. So you might see those melasmic brownish, reticulate or reticular pigmentary networks, superimposed, with the ochronotic features. So we've come to the end. I hope this brief presentation was really helpful, has given you an insight into on the topics of both endogenous as well as exogenous ochronosis. I hope it's been helpful. Thanks for your engagement.